right, welcome back on the Good Morning Artesia radio show. And joining us here in studio is Dr. Salgado from Artesia General Hospital. And really appreciate you taking the time to come in and chat with us today.
Hey, thanks for having me.
It is, healthcare has certainly been one of the top topics on the minds of everybody, especially with COVID and the pandemic. And here lately, we've seen a tremendous spike in the number of new cases, especially here in southeastern New Mexico. And kind of bring us up to date as to what you're seeing out at Artesia General Hospital.
So, what I wanted to do is kind of talk to you about kind of what we're seeing on the ground here, and without kind of any of the politics and, all the mandates that, we're all having to kind of navigate. What we're seeing is a significant uptick in cases, not only here, but you're seeing it in Lovington, Hobbs, Carlsbad, Roswell. As a matter of fact, we communicated with a couple of the CEOs in the area, and all their beds are at capacity. As we were talking earlier, Norley and Lovington has kind of reallocated staff to kind of help mitigate some of the problems they're having with staffing, in response to the uptick in COVID cases. And if you follow the case count, per county, unfortunately, down here in southeast New Mexico, we're keeping up with, Albuquerque and Doña Ana County, which have a lot more population. And so it's unfortunately related to our vaccine, percentage. No matter what side of the aisle you kind of, sit on, or how you feel about vaccines, the problem and what we're seeing right now is, definitely related to the fact that, hey, we don't have enough people vaccinated, but also this booger is a little different than what it was in 2020.
You're talking about the
Delta variant, yes.
Okay.
Though we do not get direct feedback from the state about, hey, who's got what, but we get general feedback about there's a high percentage of the cases are related to the Delta variant. Most of what we're seeing in the hospital, unfortunately, is, non-vaccinated individuals. I will tell you this, that over the last week, we had 4 individuals intubated and on the ventilator. And that's been quite some time since we've seen that, at Artesia General Hospital. The unfortunate thing is we can't get them to higher levels of care. Lubbock's has no beds, El Paso has no beds, Albuquerque, Roswell, Carlsbad. So we're busting at the seams. And so our nursing staff, our frontline staff, our physicians in the ER and on the hospital ward are tired. They've been doing this for 20 months. We don't see that there's going to be anything disappearing in the next, several months. And so, matter of fact, we've got some news yesterday that possibly we might be seeing a pretty significant increase in cases over the course of the month. And that's based on some of that modeling that we kind of get feedback from. So lots going on. We have a lot of sick patients, and compared to last year, where we were seeing our 70 and 80-year-olds that were getting sicker, now it's 30-year-olds, 40-year-olds, and unfortunately, we've had some deaths, with people in their 30s and 40s, and so it's unfortunate.
So you don't know what variant of COVID, when a patient tests positive for COVID, or when they come in and they have the COVID symptoms, you don't know if this is the original variant or the Delta variant, or...
Right, and we do not, but we got some feedback probably a couple weeks ago that, over 85% of cases were related to the Delta variant. And we know it's the Delta variant because of the difference in how people are presenting. They're still sick, but people are basically like, I don't know where I got sick from, and they're getting sicker quicker, rather than, hey, this kind of, 7 to 10 day, take my time to get sick. Within a couple of days, 3 to 5 days, they're getting pretty sick. X-rays, when we do X-rays on these individuals, are looking pretty nasty. We've been sending a lot of people home on oxygen, based on their criteria just for preservation of bed space, because we've had significant amount of individuals we're holding in the ER to get hospital beds. Now, the other unfortunate thing is individuals that have usual and customary issues that they get admitted to the hospital for, whether it be heart-related issues, pneumonias, we have a hard time getting them bed space. Matter of fact, we held an individual with a aortic, aneurysm dissection for about 3 days in our ER because we couldn't get him anywhere. We're even calling as far as, Phoenix, Colorado, trying to get individuals, Dallas, Fort Worth. And what's unfortunate is all those people from those states are coming over here because they can't get into ERs, where they're at.
So you're seeing people from, say, West Texas that are coming to Artesia,
or even your, like Lovington and Hobbs. I know an individual who has an acquaintance that he drove to Lubbock to be seen, and there were several individuals, and this is anecdotal evidence that they were from out of Texas, that drove there to see if they could, get some help. So
wow,
yeah,
so it's affecting the healthcare system
right.
all over. So what you're seeing, what are the differences that you're seeing with the Delta variant versus the other? We've all heard or been told that it's more contagious, which you've
right.
mentioned. But what has been the effect on individuals? Because the original variant seemed to primarily affect older individuals
right.
or people with underlying conditions.
Right.
What are you seeing with the Delta, this particular variant?
I think, the issue of having health problems still remains a significant factor. This one seems to be really impacting our 30 and 40-year-olds significantly. And the other thing is, it's basically, as much as I could kind of simplify it, it's passed very easily. And what we're seeing is we're getting more kids, So yesterday, out of all of our testing, we had a 1-year-old, 2-year-old, 8-year-old, 11-year-old. And so all those individuals who are running around in your school system, are going back to mom and dad, and here we go, and unfortunately, it's hard for somebody to kind of isolate themselves from the home and, and get away from this stuff because, the kids still need to be cared for. And so, unfortunately, what we try to do, like we talked about, if we find individuals that need Regeneron, we try to infuse that for them. We treat them with some, other outpatient medications, including, steroids, and sometimes we'll give budesonide inhalers, and if they have pneumonias on x-ray, we'll cover them with antibiotics, to prevent any kind of like secondary pneumonia that's not viral related. But if you look at the x-rays on these individuals, they're pretty significant. Lots of pneumonia both sides, and these guys are having trouble breathing, and so it's unfortunate.
It is. Now, you mentioned Regeneron.
Yes, sir.
How do you determine when a patient is eligible or would benefit from that particular medication?
So the individuals that come into the ER, or for instance, through the outpatient clinic, that come in, basically have mild, and I say mild disease, they're not requiring oxygen, but have high risk factors, health conditions that would put them at significant risk. We try to identify those individuals and get them infused. There's about a 7 to 10 day window by the time you're diagnosed, and when we try to get these guys infused. It's a one-time infusion, trying to help kind of kickstart them and kind of get them over the hump. And sometimes it does a great job and people start to recover, a little bit quicker. Sometimes, like I said, depending on, your health conditions and your status, you can kind of roll in and kind of continue to get sicker. The issue is for us too is, you've heard about that cytokine storm, which occurs about 7 to 10 days into getting infected. And what it is, it's basically this kind of, Dr. Baca Sr., he describes it best. He says, when you see those movies when a robot, goes haywire, that's kind of what your immune system does. And so what we've done in some of the individuals that are hospitalized, we typically will give them Decadron, remdesivir, There's a medication called Actemra that is used mainly for anti-inflammatory conditions. It's for people with arthritis, but it targets those types of inflammatory markers. We use that during their hospitalization. It's a one-time injection. Unfortunately, the supplies have dwindled, and so now we're at a point where the ability for us to get this has been kind of difficult. And so
and I was going to ask you that because early on in the pandemic, they had one of the categories that the state had was PPE,
right,
and they kind of stopped putting that on the list because it seemed like everybody had enough PPE.
Right.
But these types of medications, these types of drugs that are available to help people with COVID, is Artesia General running in short supply, or how is that being handled on the statewide?
So we're doing pretty well with our Regenerons, pretty well. The narrative we had a year ago where, hey, we couldn't get PPE or, meds were being, directed by the state. Now we're we get some from the state and we get allotments, but we haven't seen the shortages, that we saw, a year ago. The Actemra, which is what we give, is in short supply. Kind of like our rapid testing agents that we do are in short supply. And so we've made some adjustments into using those for emergent cases only. And we have another platform to do testing with that we're using for kind of routine testing. And so, as a matter of fact, I've even had patients that might be traveling and recommend them getting these kits over the counter just as a screening to see kind of, what happens, so that we can kind of conserve, what we have, because we really don't know kind of what we're heading into over the next few months. And so we're trying to really conserve things. And you're seeing that same picture at Norley and Lovington. Roswell's tight, on supplies. They're tight on staffing. And so everything's, pretty much on a very fine line right now.
Yeah. Dr. Salgado from Artesia General Hospital is with us. We're talking about how things are going at the hospital.
That's right. Yeah.
You mentioned a couple times staffing. There was a group of people that were on the courthouse steps in Roswell yesterday. There's going to be a group meeting here in Artesia later today over the governor's mandate on staff being vaccinated. What exactly is the governor's mandate, and how is it impacting the staffing at Artesia General?
So, the mandate basically came down as a public health order, and it mandated that, everybody that works in a healthcare facility get vaccinated. So, I wish we could say that at Artesia General Hospital we're perfect, but we have individuals that, have elected not to get vaccinated. Those individuals, if they elect not to get vaccinated, and I think our deadline for kind of trying to square everybody away is Monday, they can claim an exemption, either through a significant medical condition, a disability, or religious exemption. Once people claim those exemptions, then what does, it goes through a vetting process through our human resources department to see if, that's something that, people qualify. Where it becomes a little bit of a challenge if they do get an exemption is us making accommodations, especially for those that, work in, areas where, they're exposed and, work with, patients and stuff. So there's a lot of, moving parts to this. And so we're concerned about it because it could have an impact on, staffing as we have. And we're already tight, with regards to nurses. And, my recommendation to people in the community, if you know one of your nurses that, works at the hospital and works on a med-surg floor, then I suggest you give those guys a big hug, because those guys right now are our engine, and we need to try to keep them going, because we don't know how long it's going to go, because like I said, nursing is in short supply across the country. But going back to that vaccine mandate, that's kind of where it stands. And so we're kind of trying to navigate that. I think that's what some of these rallies have been for, with regards to these mandates. I think the big picture to take away, and, from the hospital and myself being the CEO now, but also being a physician, that, our medical staff is, very pro-vaccine. We feel that the issue of getting vaccinated would allow us to kind of improve our numbers, not only here in the community, but also kind of stave off these type of surges that we're seeing. Right now, about 98% of the cases we're seeing in the hospital, they're sick, coming through the ER, coming to the clinic, they're just not vaccinated. And so, we're pro-vaccine. I've always been, pro-vaccine. It's with respect to people's individual rights and liberties. The big picture here is, protecting the community and keeping them from getting sick. And that's kind of why we went into the business. Politics aside, I don't like getting into it. I don't like getting into the religious component of it. I'm here to take care of individuals, as all are my colleagues. And, we kind of stand by the fact that, hey, the more we get vaccinated, the better we'll do.
Because you are seeing vaccinated people getting sick with COVID.
They are testing positive with COVID.
Testing positive is different than them getting sick.
They're positive, but they also are getting sick, but less sick. They're the ones that are going home, recovering, and moving on, and kind of, after about 10 days. As are a lot of other individuals that aren't vaccinated. Where the big gray area is, those individuals that have had COVID confirmed, where they stand with regards to natural immunity and how that plays out is anyone's, kind of guess. And so you can probably pull up 15 articles, a day about that stuff, and, arguing for and against it. So it's a tough, topic to kind of navigate.
But the way the health order is structured, though, the hospital, any hospital, Artesia, you don't really have any leeway or options in this. You can't, if they get tested every week, continue to be able to work. They have to declare that they're going to get vaccinated.
So if they have an exemption that is accepted, then they get on to a testing protocol, thereafter, weekly. So, and that therein lies, some of the dilemma as well is, okay, how do we test these?
Because you already mentioned that
we're short on testing, right? So, yeah, and
then you throw in like the schools, you have to get tested every week if you don't, and it's not a percentage of the unvaccinated staff. It's 100%.
It's all those guys that if they get an exemption and get approved and they continue to work, they got to just get tested every week. And so so we're trying to kind of navigate how we're going to do that. And once again, like a lot of other things, we have these mandates that we have to navigate through, and with all due respect to everybody and how they feel, and one side or the other, it's for us right now, the plea from me personally, and I think I would kind of speak on behalf of the organization, is us trying to get more people vaccinated so that we have less caseload and that we can kind of breathe a little bit. Right now, we're kind of busting at the seams, and our nurses are tired. They've been doing this for 20 months, docs in the ER, 20 months. And even the docs in the ER will tell you, this stuff looks a little different, and I think what's, going back to...
You're talking about the Delta variant.
The Delta variant. I said, going back to, kind of the boots on the ground, the unfortunate thing is we're just seeing young people with really, really significant illness. And, these are guys that are married and have 2 or 3 kids. And, it's it's unfortunate.
It's not a good thing at all. Has the staffing situation affected any of the services that are able to be provided at Artesia General at this time?
No, we haven't had any, impact on the services. Now, that doesn't mean that if, a couple of our nurses, wake up one day and say, hey, I'm getting out of the business because I'm tired of this, which is kind of a significant proportion of individuals across the country. They're just kind of getting out of nursing because of the significant fatigue and, mental, distress they've been under. And so, but right now we're, fingers crossed, we're been able to kind of staff, and we're moving forward. And I think we're pretty strong on the med surg side, ER, the OR side. we have some challenges there because sometimes, it varies on, hey, is the nursing shortage going to be in, the recovery room, or is it going to be in the, on med surge, in the post-operative state. So, but thus far we're holding steady.
Holding steady. Yep. And for folks who want to consider getting vaccinated, is the hospital still doing the vaccination clinic?
We are. Right now we're doing it every Wednesday. We've seen an uptick in some requests for vaccine. What we're asking individuals to do is to register with the Department of Health, and once they get that confirmation number, they can reach out to us over at the Memorial Family Practice Center at the hospital, and we can facilitate them getting an appointment. Now, Lowell's continues to vaccinate. I think PMS is as well, and then Walmart is as well. And so everybody kind of continues to do that. There's a lot of Moderna and Pfizer available. Johnson & Johnson is in short supply, and then that one's a little harder to get.
A little harder to get.
And I think, and we're looking to kind of ramp up our vaccinations coming up in the next couple of weeks because of that third shot booster.
Okay.
And so we've had a lot of interest, from some of our two-shotters.
And the FDA has now approved the Pfizer. Can you pick between one or the other, or is there a reason to pick one over the other? Like Pfizer is approved, but Moderna not yet? Or?
No, I think, when I have that vaccine discussion, a lot of people have focused in on the mRNA issues, which, the technology's good. It's been around for a while, and it's basically been used to develop other vaccines in the past. Everybody argues about, hey, this was done quickly. It was, but, the science is good behind it. What they're recommending is, hey, if you got Pfizer, try to get Pfizer third dose. If you got Moderna, try to get Moderna third dose. Article came out today where I think Johnson & Johnson is kind of right behind, and so I'll imagine they'll recommend a second dose. And so the vaccines themselves, it's almost kind of like when you compare Moderna and Pfizer that are mRNA vaccines to Johnson & Johnson, which utilizes a virus as a vector. It's apples and oranges, but it's fruit, so it's still good for you. So that's the best analogy I can give you. So,
yeah, that's great.
Yeah. So, but yeah, and if you read some of the articles as well, they're kind of like, hey, maybe we should do 2 Pfizer, 1 Johnson & Johnson, and when you get into that stuff, we wait to kind of see what the science is behind it. And like I said, I'm in medicine because I believe in science, and, we'll leave it at that. So.
Very good. Anything else you'd like to bring up today?
Really if there was a plea I could, put out to the community is, hey, if family members that are interested in getting vaccinated, we'd be happy to help them. It's a little bit of a process, but we can get it done. We encourage folks to get it done. Lowell's has a very efficient system as well. That's what we're going to need to get over this. The unfortunate thing with us being, in the county vaccinated at, kind of around that 40% mark, we're kind of equating this
43.2 as of Monday.
Yeah, so. We're kind of equating this new surge as kind of a big kind of forest fire, and unfortunately, us being that low vaccinated, there's a lot of brush to burn, and I think we're going to see it this month. And so, Labor Day weekend's coming up, which is always a big deal. We're seeing more kids. My prayers go out to see how the schools handle what they need to do. It's going to be a tough one. So
very good.
Yeah.
Dr. Salgado, thank you so much for your time. We appreciate it.
Thank you.